Hi friends, I am Dr. Hidayatullah, urologist in TX hospital. Today I am going to discuss about urinary tract infection. Urinary tract infection is very common problem. The reasons for urinary tract infection can be many. So I like to simplify this discussion. Urine infection depending on the age of the patient. Urine infection can be there in the children's. Urine infection can be there in adults. In adults, females the reasons are different, males the reasons are different. In elderly people above 50-60 years the reasons are different. So, and the management treatment is also different. Urine infection patients present to us with severe burning sensation and sometimes they may have fever. If it is the urine infection is extended to the kidney, they can have chills and rigors along with the fever. So, after the patient comes to us, depending on their age, we suggest them some investigations like ultrasound scan to know where the problem is. Sometimes if the patient is having a stone, they can present to us with a urine infection. If the patient is diabetic, elderly, the reason can be uncontrolled sugars, and if it is young couples, then they may present because of sexually transmitted urine infections. So there are different reasons with which the patient present to us. So depending on their age, we suggest them to get an ultrasound, complete urine examination. If required, we suggest them to get an urine culture and sensitivity, and depending on the reports, we treat their condition. So if children are there, children may have urine infection because of congenital abnormalities. Congenital abnormalities like pelvic junction obstruction, posterior urethral valve or neurogenic bladder, these are some of the reasons by which vesico-ureteric reflux. These are some of the rare conditions or common conditions in which we see in children, because of which they develop urine infection. In adults, for example females, they have different reasons. Sometimes they may have without any reasons they may have urine infection. So females tend to have more often urine infection compared to males. So we treat them with simple antibiotics first according to their culture report, and we suggest them to take adequate water intake. If the patients are dehydrated, that can also be the reason for their urine infection. So we suggest them to take adequate water, and we suggest them some citrate containing fruits or alkalizing agents like cranberry juice, which can alkalize the urine, and to some extent their symptoms of burning sensation may subside. And antibiotics will help them according to their bacteria. Most commonly we see E. coli and culture report. If there some specific antibiotic is working well for that bacteria, we suggest them that medicine to them. And in adult males the reason for urine infection can be prostate, stones or uncontrolled diabetes. These are some of the common reasons which we see in our outpatient clinics. These are some of the treatment methods. If at all the urine infection is not subsiding, then we need to investigate more. Sometimes the patient may have surgical reasons for urine infection like stones. Stones are a very good source for the bacteria to stay. Even on taking antibiotics, the stone, if the bacteria is stuck in the stones, the antibiotics may not function on the stones. So these people, we need to remove the stone, then only the recurrence of infection will be prevented. Otherwise they may have recurrent UTIs. Thank you.